The title Lifestyle versus Medications really should be lifestyle first, and then be ready for medications if they're needed in the future. Why lifestyle first? It is the most important aspect of being able to manage type 2 diabetes. Type 2 diabetes requires new habits to be ingrained in your system. It may require ability to lose weight. Endocrinologists and physicians will tell you that when they check your A1C, your level of blood sugar levels over 2 to 3 months, if it's over 7.0, they will suggest that you take meds, although they may give you a month or 2 or 3 to get it below 7.0 before they give you meds or they recommend meds. Many people would like to avoid meds, and I'd like to avoid meds also. And for a long time, I avoided meds. I made the mistake of avoiding meds longer than I should have. And I ended up having higher blood sugar levels than I should have. The reality is that you do not want to have high blood sugars at the risk of not taking medication. It's more important to manage your type 2 diabetes successfully than to manage your type 2 diabetes without medications. The most important thing is managing your type 2 diabetes successfully. Beta cells are the cells that produce your insulin. When your beta cells are overused, and they're overused if your blood sugars are high at times. And when that happens, what happens is your beta cells wear out and they get depleted, and it's harder for them to produce insulin. And when it's harder for them to produce insulin, it's harder for you to produce insulin. And as a result, you may need to take medications. I've had type 2 diabetes for almost 40 years now. And one of the reasons that I take medications is because over that 40 years, the first 35 years, I very often would have high blood sugars. And those high blood sugars caused my beta cells to be depleted. In reality, now that I take Ozempic, I think that there's a good chance that my beta cells are being replenished because I take less medications now than I ever did. And the medications that I do take help me control my weight. So if you do need to control your weight and you think you need medications, discuss that with your endocrinologist. And I strongly encourage you to use an endocrinologist as opposed to a general practitioner. And the reason I do that is because using an endocrinologist is more likely to be using someone who knows what they're talking about and knows what the standard protocols are for dealing with type 2 diabetes. So I want to encourage you to make sure that you understand what you need to do to control your type 2 diabetes. But one of the reasons why medications are increased over time is because there'll be times during your life when you won't control your blood sugar perfectly. It's idealistically, it would be great if you can go for your entire lifetime and never have sugar, eat a low-carb diet all the time and control your diet perfectly, exercise regularly. It's unlikely that you're going to be able to do that regularly for your entire life. And that's why doctors call it, and endocrinologists call it remission. They don't call it reversal. So you're not really talking about reversing diabetes, you're talking about getting it in remission. The longer you can have it in remission, the better off you are. So I do want to encourage you to try and be in remission as long as you can, maintain a healthy exercise level. We go over your exercise routine, and we go over your routines for developing a program to service your type 2 diabetes in a way that's healthy for you, not for anyone else. We need to develop a system that's designed for you. The system that's designed for you will be habits that are designed for you. Eating habits don't require one particular diet. They require a variety of possible diets, but they're improved. They're improved because you'll eat less. You'll improve your diet because you will stop eating sooner. You'll eat more of the healthy things that you should be eating and less of the unhealthy things. The unhealthy fats and the unhealthy sweets will be reduced, and your healthy fats and your healthy carbs are more likely to be part of your diet. But it all depends on what your diet is to determine what your diet we're going to encourage you to follow. And we help you do that in your program. But in the long run, your physiology will dictate whether or not you need medications in the future. The medications that we have these days are so much better than the medications they used to have. SGLT2s like Farxiga and GLP-1s like Ozempic are far superior to the drugs that we used to have in the past. So I want to encourage you to make sure you follow those. If any of this resonates with you, I want to encourage you to check out our program. Our program is listed it's called the Type 2 Pivot Method. It's listed in our guide, in the bio below. You can look it up, and you can either get our free guide, or you can actually subscribe to the program. There are two ways you can subscribe to the program. I'm organizing a group of several people that are pre-webinar group. And if you want to join that group, it'll be starting soon. Or you can just sign up and we can get you started soon. The program will be a 5-week program, and each week you'll get new videos, and you'll be getting new worksheets, and you'll get a program with me where you can learn how to control your type of diabetes with exercise, sleep, stress, and everything else that's needed to control your types of diabetes. I want to encourage you to follow this, and I want you to encourage you to follow and subscribe to our system. Follow the system button right below so that you can follow our programs on YouTube. Thank you and have a great day. Bye.